Next, I like to call Dr. Mahideen Abdul Kader sir to screen myocilin mutation in a large South Indian family with early onset.
Good afternoon, sir. So I'll be talking about to screen myocilin mutation in a large South Indian family with early onset JOG and POG. These are my co-investigators along with me. And the background of the study is we have 26-year-old female high school teacher who presented to OPD, busy OPD with 1 year duration of defective vision. Her presence is 50 in both eyes, and she had 6 illness in people, a poignant cup, open and glaucoma. We were stunned to see her so big, copying with pallor and all kind of things. So we pulled her brother who came along with her. We found her pressure is 54 and 46. He didn't have any complaint, but upon people defect and poignant cup in both eyes, and he had a big fundus picture of this patient. Then we thought the family history, they asked history of family history, glaucoma mother, grandmother. Then we thought we something had to do for that. So we went to the village called Kaladali, which is 100 kilometers from Madurai, Ramnath district, literacy rate of 70%. We took a slit lamp, we took a tone up pen, we took a gonioscopy, we in a comprehensive examined at the campsite itself. So we also took a blood sample for genetic analysis. We had a counselor, we had a photographer who can take the handheld disc photograph and all that done the same day. This is a part of a World Glaucoma Week done a few years back. So now the objective is to screen a myocilin mutation in a large South Indian family with the early onset of juvenile glaucoma and the early onset primary open glaucoma. So we have done, I told you, all comprehensive exams, even gonioscopy is done at that the base visit. And we all taken the patient with open glaucoma, angle glaucoma excluded from the study. And we look at the younger age group in POG, age less than 40 years, and age diagnosis is 31 years. Gender proportion is equal in all the three groups. And look at the IOP. IOP is around 29 millimeter, 29.2 millimeter, especially in a POG compared to POG suspect and control is significant. And complete is 0.87 in POG compared to a POG suspect and POG control is POG less than 0.001. So the bar diagram again shows the POG has a higher IOP and lower CCT and higher CD ratio. So we also compared clinical profile of the proborn, offspring, and sibling. We found out the proborn and siblings are severely affected, whereas the offsprings are unaffected, but they are myocilin positive. So these are the pictures of the patients of the A and B or C are patients of proborn brothers and sisters, and D and E are proborn's children. So the rate of progression among these people, the proborn and siblings, are 2.8 minus 2.86 decibel per year in a visual fields. The age of diagnosis at the age of 20 to 30 years, especially in 40,000 people are diagnosed at the age of less than 30 years. So the blood samples were affected. All the patients were written consent. We taken for DNA extraction and also bidirectional sequencing was done for myocilin gene mutation, and whole sequencing was done for the patients of myocilin negative, especially in POG suspect patients. So then the researcher came to the campsite. So the Dharmalingam and Barnitharan, the professor from the Aravind Medical Research Foundation, they came to the campsite. So we took and done a pedigree. It was surprised to see a pedigree. The proborn is the arrow mark. She is a positive for myocilin. Two brothers are positive for myocilin. A sister is positive for myocilin. A mother is positive for myocilin. Grandmother is positive for myocilin. Her mother's brother is positive for myocilin. The whole family is positive for myocilin with high intraocular pressure. So out of 40 members we screened for myocilin mutation in axon 3, we found out that 20% people are positive with an N460K in axon 3. And out of 20 people, 15 were PAOG and 3 were JOG successful, 2 were control. Youngest one is at 10 years. And there are 18 mutation people age of more than 10 years. 70% have disease percentage of 94%. And the POG suspect and JOG suspect 2 carry a mutation. The carry mutation, the axon 1 of the myocilin, the common variant, and 2 control will be slowly closely followed up. So our study is found that N480K alteration is characterized by high intraocular pressure and younger age of disease, and nearly 80% of patients need a filtering surgery to control intraocular pressure. And whole sequence examining done for this patient who appears suspect, we identified L432V in a CYP1B1 gene and R76K in a myocilin gene. So further screening of this polymorphism in this close relative reveals the inheritance in the family and is associated with the POG suspect. And our conclusion was JOG had high intraocular pressure and the female is highly predominant. In a POG, the female is 1:1 and the IOP is around 20.57. To conclude, a strong family history glaucoma with high IOP and younger age of persons like our study warranted genetic testing for myocilin gene mutation, especially in our setup. Younger carriers identified in the study need to be followed carefully the symptom of initial intervention, emphasize the importance of screening of myocilin gene and other gene variant in family-based studies. To conclude, JOG patients in the myocilin mutation that reportedly have high intraocular pressure and early onset, a left anterior result in visual impairment, And screening of myocilin mutation among JOG patients of this family helps in detect disease early. Early detection will allow better therapeutic intervention. Thank you.
Thank you. Question. Thank you.